Vicks Dayquil is a combination medication used to temporarily treat cough, stuffy nose, body aches, and other symptoms caused by the common cold, flu, or other breathing illnesses. It contains dextromethorphan, which helps to reduce the urge to cough, and decongestants to relieve stuffy nose symptoms. It also contains acetaminophen, a non-aspirin pain reliever and fever reducer. It is important to note that this medication is not recommended for ongoing coughs from smoking, asthma, or other long-term breathing problems, or for coughs with a lot of mucus, unless directed by your doctor. It is also not recommended for children younger than 6 years, unless specifically directed by a doctor. It is important to carefully follow all dosage directions to decrease the risk for serious side effects. Remember to not use this product to make a child sleepy and to not give other cough and cold medication that might contain the same or similar ingredients. Always consult with your doctor or pharmacist for more details about using this product safely. When taking Vicks Dayquil, it's important to carefully follow the directions on the product package. If you have any questions, it's best to consult your pharmacist. You can take this medication by mouth with or without food, as directed by your doctor. If you experience stomach upset, you can take it with food or milk. If you're using the liquid form, be sure to measure your prescribed dose using a medication measuring device or spoon. Do not use a household spoon, as you may not get the correct dose. If the liquid form is a suspension, be sure to shake the bottle well before each dose. If you're taking the chewable forms, make sure to chew thoroughly before swallowing. The dosage of Vicks Dayquil is based on your age. It's important not to increase your dose or take it more often than directed without your doctor's approval. Misuse of this medication may result in serious harm. If your condition lasts for more than 1 week, gets worse, or occurs with a headache that doesn't go away, rash, or fever lasting more than 3 days, it's important to let your doctor know. These could be symptoms of a serious medical problem and should be checked by a doctor. Some common side effects of Vicks Dayquil may include dizziness, drowsiness, headache, nausea, nervousness, or trouble sleeping. If any of these effects persist or worsen, it is important to contact your doctor or pharmacist. It's important to remember that if your doctor has prescribed this medication for you, they have determined that the benefits outweigh the potential risks. Many people using this medication do not experience serious side effects. However, it's important to notify your doctor right away if you experience any serious side effects, such as changes in mental/mood, shaking, tremors, weakness, or difficulty urinating. Seek immediate medical help if you experience very serious side effects, including chest pain or fast/irregular heartbeat. While rare, a serious allergic reaction to this drug is possible. Seek immediate medical help if you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Vicks Dayquil contains acetaminophen, which is an important ingredient. It's important to not take more than 4,000 milligrams, 4 grams, of acetaminophen a day. If you have liver problems or are giving it to children, you should take less acetaminophen. It's best to ask your doctor or pharmacist to make sure you're taking a safe amount. Make sure not to take any other medications with acetaminophen without checking with your doctor or pharmacist first. Acetaminophen can be found in many over-the-counter and prescription medications, like pain relievers, fever reducers, and cold medicines. Check the labels on your medications to see if they contain acetaminophen, and ask your pharmacist if you're not sure. If you accidentally take too much acetaminophen, it's important to get medical help right away, even if you feel okay. Symptoms of an overdose can include nausea, vomiting, loss of appetite, sweating, stomach pain, tiredness, yellowing of the eyes or skin, and dark urine. It's also best to avoid alcohol, especially if you're taking acetaminophen, as daily alcohol use can harm your liver. Before taking Vicks Dayquil, it's important to talk to your doctor or pharmacist if you have any allergies or medical conditions. This medication may make you dizzy or drowsy, so it's best to avoid driving or using machinery until you know how it affects you. It's also important to be cautious if you have diabetes, alcohol dependence, liver disease, or phenylketonuria, PKU. Before having surgery or if you are pregnant or breastfeeding, be sure to discuss the use of Vicks Dayquil with your doctor. Older adults may be more sensitive to the side effects of this medication, so it's important to be aware of any potential symptoms. It's important to be aware of potential drug interactions that could change how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist to avoid any negative interactions. Certain MAO inhibitors should be avoided while taking Vicks Dayquil, so it's important to consult with your doctor before starting or stopping any medications. Additionally, be cautious of products that may interact with Vicks Dayquil, such as ketoconazole and rolapitant. The ingredients in Vicks Dayquil may be found in other prescription and non-prescription products, so it's crucial to check the labels on all your medications to avoid taking more than one product with the same ingredients. Be sure to consult your pharmacist if you have any doubts about the ingredients in your medications. It's also important to inform your doctor or pharmacist if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, or drugs for sleep or anxiety. Additionally, Vicks Dayquil may interfere with certain urine lab tests, potentially causing false results, so it's important to inform lab personnel and your doctors that you are using this medication. Remember to check the labels on all your medicines to ensure you are using them safely. If someone has taken too much Vicks Dayquil and is experiencing severe symptoms such as passing out or difficulty breathing, it is important to call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can call your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center. Symptoms of an overdose may include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, yellowing of the eyes or skin, dark urine, agitation, confusion, hallucinations, and seizures. If you or someone else is experiencing any of these symptoms after taking Vicks Dayquil, seek medical help immediately. Make sure to keep all your medical and lab appointments, as directed by your healthcare provider. This will help monitor your progress and ensure that Vicks Dayquil is working effectively for you. If you are taking Vicks Dayquil on a regular schedule and happen to miss a dose, take it as soon as you remember. However, if it's close to the time of your next dose, just skip the missed dose and take your next dose at the regular time. It's important not to double the dose to catch up. When it comes to storing Vicks Dayquil, it's important to follow the instructions on the label. Make sure to protect it from light and moisture, and avoid storing it in the bathroom. If you have any questions about storage, it's best to ask your pharmacist. And always remember to keep all medications out of reach of children and pets. When it comes to discarding Vicks Dayquil, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard the product and it is expired or no longer needed. It's a good idea to consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.